it is very important for you to know this. Probably you've heard it a lot, but I would like to clarify a little bit more. So redness of the breast, yes, definitely. This is one of the most alarming symptom. It's not, I wouldn't say it's the most common symptom, but you have to pay attention to that, especially if it's asymmetrical. That means it's only affecting one of your breasts. Also, asymmetry itself, which is having a breast that's bigger than the other one. That's another symptom. Of course, we have to understand that for every woman, there's a little bit of asymmetry. Breasts are not exactly the same. One is always bigger than the other, but this asymmetry is almost always not very obvious. Of course, women know because they know themselves, so they already know that they have one breast that's bigger than the other. But that's almost impossible to see for somebody else different from the actual patient. But if you have you're developing a asymmetry, one of your breasts is growing or actually shrinking, that can happen also. That's a symptom. If you're having pain or itchiness of the breast, that's also another symptom. If you feel there is any change in the skin of the breast, that is a symptom. But actually what we call orange skin, that is the most, I would say, the most alarming, because that means the certain part of the breast, which is the lymphatic ducts, are getting clogged. So you have the skin in the breast starts to look like the skin of the orange. So if that happens, that's definitely a symptom. And the last one is the swelling of the lymph nodes, which is very common, unfortunately. So that can be a little bit misleading, because every time you have an infection, the lymph nodes are going to swell. It's very common that if you have like an ear infection or a throat infection, your lymph nodes in the neck are going to get swollen. And if you have an infection on your hands, on your nails, on your fingers, on your arm, then the lymph nodes in your armpit are gonna get swollen. That's normal. But of course, if you see these nodes are swollen without you having any infection, any disease, anything in your skin, and if that persists for more than 20 days, a month, that's something you should get seen, just to check if might be something.